So imagine discovering that highly purified DNA derived from a salmon could be the key to reversing one of the most painful, under-discussed physical changes women experience as they age.
Right, it sounds completely wild.
It really does. And we aren't talking about treating facial wrinkles or neck skin today. We are diving into this, quiet revolution happening in women's intimate health.
Which is so important because the gap between the profound physical changes that happen in vulvovaginal tissues over time and, well, what patients are often told they just have to tolerate is staggering.
Oh, absolutely.
For decades, the medical approach has been incredibly reactive, if not just entirely dismissive.
Right. Which brings us to the mission of today's deep dive. We are zeroing in on a new regenerative treatment called NewGyn.
Yeah.
You've probably seen fragments of this discussed online or maybe buried in clinical brochures, but our goal today is to uncover exactly what this treatment is, how it works, and why it represents such a massive shift away from traditional regenerative aesthetics for women.
Exactly. And to do that, we're pulling from a really wide range of sources. We've got private clinical data from providers like DermaFocus and MySkin, alongside official NHS commissioning guidelines, medical reviews on genitourinary health, and a ton of clinical trial data.
Okay, let's unpack this. Because before we can truly appreciate a cellular intervention like NewGyn, we really have to look at the biological reality of the problem it was invented to solve in the first place.
Right, the root cause.
Yeah. In the medical literature, this is classified as genitourinary syndrome of menopause, or GSM. When I was looking at the pathology of GSM, which used to just be called vaginal atrophy, the mechanical breakdown of the tissue is honestly startling.
It really is. The clinical reviewers make a very clear point that this isn't just a superficial dryness issue.
Right.
It is a fundamental structural collapse triggered by dropping estrogen levels. Estrogen is essentially the biological driver that maintains the thickness, the elasticity, and the cellular turnover of that mucosa.
So it's basically feeding the tissue?
Exactly. It dictates blood flow and regulates the local pH. So when estrogen plummets, whether that's natural menopause, postpartum shifts, or even chemically induced menopause from oncology treatments, the tissue essentially just starves.
Wow. And the literature describes the resulting symptoms as visceral. I mean, the mucosa thins out to the point where patients experience micro tears. They literally describe it as a paper cut sensation.
Yeah, that's exactly how patients describe it.
Along with severe itching and dyspareunia, which is painful sex. I mean, the friction on that compromised tissue must be immense.
It creates this awful compounding cycle. Yeah. Starvation creates tissue fragility. That leads to mechanical trauma from friction, which then triggers chronic localized inflammation.
Right.
It fundamentally alters a woman's biomechanics and her confidence. It's a massive quality of life issue.
So looking at the standard medical toolbox for this, the first-line defenses seem almost insultingly inadequate for a structural collapse. I mean, moisturizers and temporary lubricants, water or silicone-based lubes.
Yeah, that's usually step one.
But using deductive reasoning here, it sounds like traditional moisturizers are like spraying water on a dying plant, while hormones try to change the weather.
That's a really good way to put it.
Right, because applying a surface moisturizer completely ignores the root cellular deficit.
Which is why practitioners quickly move to the next tier, which is localized vaginal estrogen, DHEA, or full systemic HRT.
But here's the thing. Not everyone can or wants to take hormones. Like, breast cancer survivors are often disqualified from those treatments, and some women just don't want to alter their systemic hormonal baseline. So what happens if neither is an option?
This raises an important question. How do you achieve structural repair without relying on hormones? Historically, medical science just didn't have a good answer for that non-hormonal middle ground.
You either manipulated the hormones or managed the pain.
Exactly. And that gap is exactly where cellular biostimulation has entered the picture, which brings us to NewGyn.
Yes. So what exactly is NewGyn? The manufacturer, Mestelli, is an Italian biotech company, right?
They are. They've spent decades isolating these specific bioactive molecules. NewGyn is essentially a 2 milliliter pre-filled injectable gel, and it features this highly specific triple action formula.
Okay, let's break down the ingredients because this is where the aha detail really hit me.
Now, the formulation is fascinating. The primary ingredient is 20 milligrams of polynucleotides.
Right, and I want to pause on the polynucleotides because the origin is wild. These are highly purified DNA fragments derived from trout or salmon sperm cells.
They are.
Using fish DNA to biohack human tissues sounds like absolute science fiction. How does that actually work?
Well, Polynucleotides are the building blocks of DNA. When injected, these highly purified fragments stimulate your own fibroblasts.
Oh, wow.
Yeah, they actively command the local cells to produce new collagen and elastin, basically forcing the tissue to repair itself from the inside out.
Okay, but building new collagen takes time. If
Yeah,
these patients are dealing with burning and tearing today, how does this help immediately?
that's the second ingredient. It has 20 milligrams of non-cross-linked hyaluronic acid.
Ah, okay. The non-cross-linked part is key, right? Because normally hyaluronic acid in facial fillers is this thick, cross-linked gel used to add volume.
Exactly, and you definitely do not want to add bulky volume to delicate vaginal tissue.
That sounds like a mechanical disaster.
It would be, but non-cross-linked hyaluronic acid is totally fluid. It disperses rapidly and acts like a massive sponge, providing immediate deep tissue hydration and moisture while the DNA does its slower regenerative work.
And then there's a third ingredient, right? Mannitol.
Yes, mannitol is a water-binding agent and a powerful antioxidant.
So if we look at the tissue like a garden, the hyaluronic acid is the immediate watering, the polynucleotides are the seeds and fertilizer forcing new growth, and the mannitol is the bodyguard or greenhouse protecting the hydration from evaporating.
That's exactly right. It's an elegant combination. It aims to address the mechanical side of GSM, improving slip and elasticity without touching the body's systemic hormones at all.
Having a revolutionary formula is great in a lab, but what does it actually mean for the patient in the clinic? Like, how is this actually delivered?
The procedure itself is remarkably fast. It only takes about 10 to 20 minutes in a clinic. Practitioners use a topical numbing cream first, and then they use microdroplet or retrograde linear injections intradermally into the vulvovaginal area.
Okay, wait, needles down there. I mean, that sounds terrifying and honestly painful. What is the recovery actually like?
I know, the administration sounds daunting, but the downtime is actually minimal. Patients might experience temporary redness or some mild swelling, but they can resume normal daily activities almost immediately.
But there are some strict rules, right?
Yes. The main protocols are no sexual activity for 24 to 72 hours. And you have to avoid tampons, hot baths, and intense exercise for a few days to let the gel integrate.
That makes sense to avoid friction or displacing the gel. What about the timeline for results?
The standard protocol is usually 3 to 6 sessions, spaced about 2 to 4 weeks apart, though some clinics suggest 7 to 14 days.
Wow, that's quite a loading phase.
It is, but the clinic data shows patients report up to a 50% improvement in symptoms after just 2 sessions, and near 70% improvement after 5 sessions.
That is massive for someone dealing with chronic pain.
It really is. And then maintenance is just required every 6 to 12 months. Cost-wise, it sits around £400 per session.
Which is an investment, for sure. So now that we know how it works, we need to objectively look at where NewGyn fits into the broader landscape, right? Like, who is this actually for and who should actively avoid it?
Right. It's ideal for menopausal women, of course, but also for postpartum recovery or anyone seeking non-surgical labial rejuvenation. But the exclusions are strict. It is absolutely not for anyone with an active infection like thrush or a UTI, not for pregnant women or anyone with unexplained bleeding.
And obviously anyone with a severe fish allergy, right, due to the salmon DNA.
Exactly. That is a major contraindication.
Here's where it gets really interesting, because we've compared this regenerative approach to the older, more drastic options. The contrast is stark. Let's talk about surgery first.
Yeah, labiaplasty and vaginoplasty.
I was looking at the NHS stance on this, and they rarely fund these surgeries. They view them mostly as cosmetic, with very limited clinical value for actual functional improvement.
Yes. The data on surgery for this is actually quite grim. Up to 80% of surgical attempts to create a socially normative look end up requiring further reconstructive surgery.
80%? That is terrifying.
It's a huge risk. And cutting away tissue doesn't fix the cellular starvation problem anyway.
Right, it's just altering the geometry. So if not surgery, what about lasers? Transvaginal lasers like CO2 or erbium.YAG are everywhere now.
They are very popular, but they operate on controlled thermal injury. They purposefully inflict microburns to force a wound healing response.
Which sounds risky on tissue that is already paper thin and tearing.
It is. In fact, NE's guidelines and urogynecological committees clearly state that long-term safety and efficacy trials for these lasers are still desperately needed.
So that really puts NewGyn into perspective. It sits in this unique, minimally invasive sweet spot.
Precisely. It completely avoids the scalpel and irreversible excision of surgery, and it avoids the thermal injury of lasers. It focuses entirely on biological cell turnover.
It really is a complete paradigm shift. To quickly recap our journey today, we've gone from the taboo silence of intimate discomfort to using highly purified fish DNA and hyaluronic acid to basically biologically rewind the clock on tissue health.
And all without synthetic hormones or surgery.
Exactly.
Ultimately, knowledge is power. If you or someone you know is suffering in silence with these intimate health issues, just understanding that these regenerative, non-hormonal options exist is the very first step to reclaiming comfort and confidence.
Absolutely. But before we wrap up this deep dive, I want to leave you with one final, really provocative concept drawn from the clinical nuances in these sources.
Oh, the psychological aspect.
Yes, because while NewGyn can physically repair the tissue and improve elasticity, the sources highlight this fascinating phenomenon called pelvic floor guarding.
Right, it's a subconscious response.
Exactly. It's a protective, subconscious muscle clench that happens after months or years of painful sex. The body learns to anticipate the pain and just locks up.
The central nervous system just takes over to protect you.
Yeah. So it leaves you with this thought. If science can now biohack and regenerate our most intimate tissues with DNA, how much of our physical pain is actually locked in the subconscious muscle memory of the mind? A needle can rebuild the skin, but it's up to us to retrain the brain.